We want to welcome everyone to the Facebook Live event. We're so excited to be here today with the National Parkinson Foundation, now the Parkinson's Foundation, and we're just so appreciative of what a great organization and all the education that's been happening during the time of Corona and all of the new programs and things to try to reach out and help people. And so I want to say a great big thank you to the Parkinson's Foundation. There's also a wonderful helpline, 1-800-4PD-INFO. If you have specific questions, we have the best. I mean, these are the best people in the field that are there to answer your questions. This is just a staff of nurses and experts that are there to help at all times. And we also have lots of things, online forums, lots of information on the website, some free books for download, and the Aware and Care Kit for hospitalizations. And so if you're going to be going in the hospital, these things are great. And so a lot of great resources, and want to really thank the Parkinson's Foundation for this webinar today. And it's my privilege as the medical director for the foundation to have the opportunity to talk about living with Parkinson's disease. And when we talk about living with Parkinson's disease, we really get a tremendous number of questions, because there's so much that we can do to help people to really have great lives. And we always say that you can live a great life with Parkinson's disease. And so what we'd like to do is we'd like to spend this time, today talking about this new book. It's really just been released here. It was caught in the warehouses in Canada. This is Robert Rose Publishing. Now, Robert Rose Publishing is worthy of mention because they're famous for their cookbooks. And so they worked with us to create a product where we have lots of charts, lots of cases, lots of pearls, summaries, and even a summary of all the tips for better living. And this was written by Drs. Irene Malati, Dr. Wissam Deeb, and myself, all three Parkinson disease neurologists. And it was stuck. It was stuck. The Living with Parkinson book was stuck in the warehouses in Canada at the beginning of Corona, and so we couldn't get it out to people, which was a little frustrating. But it's great now. It's been released. It's on Amazon. You can log in and put reviews to Amazon on the book, and it has so many good tips for living. And those of you that know me know that one of the things that I've loved to do since 2006 as the medical director for the Parkinson's Foundation is to help people with tips for better living. And so it's really just great. It's a real privilege and honor to be with you today. And we're going to talk as many tips, as many pearls as we can stuff into the hour. We also have something special today in that we have selected one random participant to receive a copy of the book, so a copy of the Living with Parkinson's Disease book, and it's going to be cool. You're going to want to see at the end of the hour, because we asked for all the different tips from people, and so we'll share who that was that won the book and what their tip is for Parkinson. So it should be super fun. Now, I want to draw your attention. We've all been together doing Facebook Lives, and so I have a lot of pre-questions already that people have sent, but I love live questions. And so if you can tell me sort of where you're from, whether it's from the US or abroad, or what state you live in, and ask any question that you have about living with Parkinson, or anything that you're wondering about that might be a care tip or a pearl, or want to know how we deal with various aspects of the disease. Please, write in here. We have live going. I see Martha Ramirez from Costa Rica. You're on. Welcome to Martha. I see Stephen Moore. I see Ali Sen has some questions. So we want to see you pump some questions up here and have a robust discussion. And so when we talk about living with Parkinson's disease, when we wrote this book, we really endeavored we endeavored to make sure that we came down and had those really difficult dialogues and discussions about what's going to be meaningful and what are the things we can get out to help people with. And one of the comments and the things that really resonated for me that we write about is how many times do we buy these self-help books and they just stay dust-filled, they don't get used, they're not on the table and opened up, they're not used for reference, they just kind of rot after you get them because they don't have the information that's really useful and they don't have it in a really usable format. And so that's one of the reasons that we worked with the Robert Rose Company, because we saw it as kind of what they do with their cookbooks. We saw this as an opportunity to do the same thing with Parkinson's and really get information out in a very meaningful way. And so this has been, you know, really cool and really nice. And so I would draw everybody's attention to some of these boxes and call outs and pearls. And I think what's really important is that as we move forward in the field, we need to come together. And at the beginning of Corona, we had another book that came out. So this is sort of the worst time to put books out, but this book called Ending Parkinson's Disease. I just want to mention that briefly because it really is a nice segue into what we're going to talk about today. And we talk in that book about the strategy of prevent, advocate, care, and treat, following that formula of the 4 pillars that we need to turn a disease like polio or HIV to move the needle, and we need to move the needle in Parkinson's. So it's P, prevent, A, advocate, C, care, and T is treat, okay? And so we want to get 50 million people. Oh my gosh, I hope for you listening. We want to get 50 million people. We're working with a group of just the most active and charismatic and greatest people in the Parkinson community called the PD Avengers. And so they're on Twitter at PD Avengers. And so they're working to try to get 50 million people to sign the pact, prevent, advocate, care, and treat, and move the needle. Today we're going to talk about the C. We're going to talk about the C, the care aspect. We have so many people, okay, that are suffering with symptoms of Parkinson, many needlessly suffering. And so we've got to take care of the C. We've got millions and millions of people who are out there worldwide, every continent, every country, okay? And one of the things that's important to remember is that when we have this number of people, we oftentimes talk about vaccines and we talk about new therapies, and certainly when we think, we're always thinking we would like to get to the C word, cure, which we should use very carefully, right? Because Parkinson isn't one disease. But when we think about, you know, what do we need to do, we cannot forget about these millions and millions of people who have Parkinson. And so that is, you know, one of the aspects that we really wanted to emphasize. And one of the things that was really cool about the book is we had this guy named Bob Dean, and Robert Dean, whose wife had Parkinson, took pictures, you know, so you can see some of the real world pictures here of patients. And so each chapter has a real picture of a real Parkinson disease patient. And it's so important because we really have to move. We have to move past this aspect of patients, and we keep talking about patients. We need to move away from patients. We need to be talking about persons. These are people, okay? And we all sort of default to talking about patients and being clinical and being sterile. But these are the people, the millions of people that have this disease, and we need to really talk about them as persons. And so I think it's great that Dr. Robert Dean did these photos for the book. He did several for the Ending Parkinson's Disease book, but he's done a whole collage of photos, and that each chapter has a patient, and it reminds us who the real heroes are. And so as we open up and we start to talk and take some questions, and I'm going to give away some tips here as we come along the way. I wanted to tell you that when we thought about the areas to cover, we thought, what could we talk about? What could we say in the book that would really resonate, but also be pearls in the important areas for care? So those of you that know, we have a few books out, one on 10 secrets to a happier life. We've had a follow-up book about the different breakthrough therapies, the 10 breakthrough therapies for Parkinson's disease. And people asked after the first book, tell us what's new. So we talked about a lot of the research and the things that were coming in the second book. But really, the third book is a return to, let's help these millions of people with Parkinson, and let's get a little more specific than we got in the first book with some real recipes and some real formulas. And so that's why we brought in Robert Rose, and we have sort of a more of a recipe and cookbook approach. And so the areas that we covered are knowing whether you have Parkinson's disease, the symptoms, getting the diagnosis right, but then a lot of specifics on exercise and rehabilitation therapies, on medications, on surgical therapies, and I say surgical therapies with an S being plural, okay? Nutrition and the microbiome, very hot area, very hot, and going to get hotter as we move forward over the next few years. The neuropsychiatric symptoms and treatments, including something that we don't pay attention to called demoralization. And we also cover what's new and caring for the caregiver, okay? So very important, caring for the caregiver, and then summarizing, bringing it all together with what we call pearls. These are tips you can take to the bank that are going to help every Parkinson patient. So we try to make it very, very practical. So again, we want to welcome everybody. This is a Facebook Live. This is meant to be fun. This is meant to be interactive. We've got plenty of stuff to talk about. We will give away the book here later in the hour to the person that is going to receive it, and we're going to get his or her tip, their best tip for better living. And so thank you to everyone, and we're going to flip right over here and start taking questions. So welcome from Costa Rica to Martha, and welcome to Stephen Moore. And we're going to move right on to Ali Sen. And Ali Sen asks us, what's the state of the stem cell solution? Why is it taking so long? What's the practicality? So remember, we're talking about practical living with Parkinson. So if you live with Parkinson's disease, you're going to keep hearing this stem cells over and over again. And there's been this promise of stem cell therapy that's been going on for year after year after year. And what happens is when we promise the public something, so when lots of people, lots of experts come out and say, we're going to cure Parkinson in 5 years, it's going to be a stem cell, we have all these lines, this is going to be awesome. It can create some controversy, it can create some difficulty with transparency, and it can also create difficulties with us being honest with patients and speaking directly to patients. So let me speak to you directly, Ali, and to all people who are wondering, where do stem cells fit in? So at the moment, stem cells does not fit into any of the buckets in terms of how we would approach treating your Parkinson or living day to day. Stem cells is still a research-based therapy, okay? So that means that anytime that you are interested in stem cells, you should be looking for a research protocol and an informed consent, and you should be sharing that, okay, with your doctors, okay, so that they can make sure, your doctors and your healthcare team, make sure it's on the up and up. It's been reviewed by what's called an institutional review board, okay, so make sure that it's truly research. Since it's not approved, you should not be paying a fee. So if you're paying $10,000, $50,000, we've seen upwards of $100,000 or more for the treatment. That's not appropriate, and it's still within the research realm. So you shouldn't pay for it. Should be informed consent, and it should be on a website called clinicaltrials.org. And clinicaltrials.org is a website that tracks all of the main research and studies, and you need to register this in order to publish. Just because it's in clinicaltrials.org doesn't mean that it is a legitimate good thing for you to do. So there's also some garbage on clinicaltrials.org. It's a great site. My apologies to those people for saying that out loud, but I think we need to talk to you straight and make sure that you understand that as a patient. So it turns out that we've learned over the years with transplants of cells and transplants of stem cells that it's very hard to get the cells where they need to go, make sure they don't divide too quickly, turn into cancers, and make sure that they're going to not only the circuits important to motor functions like tremor and like stiffness and slowness, but also depression, anxiety, cognitive dysfunction, walking. And so it turns out that stem cells have not been the panacea, okay? There's still some good research going on about this. There was a single case that was published in the New England Journal of Medicine recently. And so there's still some potential excitement, but what I have to tell you is it's still in the research realm. It's unlikely to cure Parkinson's disease, and Parkinson's isn't one disease, and so stem cells is not a cure, and people should know that. And we're using stem cells a lot to screen new drugs and new therapies, okay? And so this area called stem cell tourism is when people charge you a lot or a little money for something that's not been approved and is in the research realm. This goes on all the time. We don't recommend it. But if you want information, you can always call our helpline at the Parkinson's Foundation, 1-800-4PD-INFO, and our nurses are awesome. They'll talk you through any questions that you have. So right now, not in the armamentarium. It's one of the hopes, but don't think of it as a hope for a cure. If it's going to do anything, it may be in drug screening or it may be in some cocktail of symptomatic therapy, but not how we imagined it 10 or 15 years ago when we promised you the stem cell cure. So Ali from Berlin, it's great, really awesome to start in Germany. So Maria Montarazzo says that her tip for living well in Parkinson is to dance, dance, and I just want to say, Maria, that that this is absolutely not just a we're going to smile and say, of course you should dance. This is a reality, and this is something that when we speak to persons with Parkinson and we speak to other doctors and groups and support groups, that we need to really emphasize that exercise, okay, and exercise is one of the things that we talk about, and we give a lot of pearls in the exercise chapter, but we need to emphasize that exercise is like a drug, okay, and so we know that it benefits patients, and now we're beginning to see, and I don't mean patients, I mean persons, so it benefits persons, and we know that we're beginning to see real, tangible symptomatic benefits. And the Mark Morris Dance Company with David Leventhal has done great work in this area. Jill Sonke here at the University of Florida, a whole bunch of people. And I remember when I was in training, and I was a fellow at Emory University in Atlanta, Georgia, with Gerald Vitek and Malin DeLong and Ray Watts and Jorge Juncos and that, just great center of excellence there. I remember when I was training a few decades ago that I had a patient who couldn't walk but could dance, okay? And so she liked to dance with me when I saw her. Now we are seeing a flood of research studies, a flood of observations showing that this circuitry in the brain, called the basal ganglia, not important you remember the name basal ganglia, but that circuitry can, in certain instances, overcome deficits and be used as a treatment. And so dance is one of those things. Tai Chi is another one of those things. And so when we think about exercise and rehabilitation, these are important tips for our patients. And so, Maria, when you say dance, 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 I say yes, yes, yes. And I also say there's lots of information. The earliest information came on specific dances like the tango. But we are seeing these benefits, and Mark Morris and other groups are beginning to publish them. People are beginning to add them to their studies. So we are now understanding that when we think of exercise and we think of movement, dance should be something we think about. So this is a great tip for quality of life, and what could be better. And when David Leventhal, at the beginning of the coronavirus, we did an interview with him and put the interview up on our ParkinsonSecrets.com website, where we have blogs, and Indu Subramanian from UCLA and I do some blogging there, and we put that video up, and it was fantastic. and we shared his video, and we did a follow-up blog with him. And many people watched that video, and even people who didn't have Parkinson's disease watched that video and benefited from doing exercise at home during Corona. So there's something to it. It's not one of those things where we just say it because it sounds cool or is nice. There is some benefit to rehabilitation and thinking of exercise and thinking of dance. So thank you, Maria. We will dance, dance, dance. So Max Facto. Max, welcome. Thank you for your question. You want to know about the keto diet and Parkinson's disease. Is it good or is it not good? Well, Max, we made Lucky 7, the 7th chapter of the book, written by Wissam Deeb of the 3 authors, led the effort on the researching of this area on the nutrition and the microbiome, and he is a doctor at University of Massachusetts, and he began to look at all the things you can do as a patient or as a person, and trying to think through, what is it that we can do that might make a difference in nutrition and in diet. And one of the things that has come up is pushing people into ketosis. Okay, so eating specific dietary elements that will have people enter what's called a metabolic state of ketosis. And when that happens, sometimes in neurological diseases, there's a bit of magic. And I say magic, and I don't use that word often when I talk with persons with diseases, but there is a bit of magic in certain children and adults with epilepsy. Not everyone, but some groups. And we're seeing now this ketogenic diet, and you may have heard it, when I say it that way instead of keto, the ketogenic diet, you may have heard of this having benefit with some neurological diseases. One of the things that we found just in following patients who have tried ketogenic diets for Parkinson, not on research studies, is that if you go to a straight ketogenic diet, it might cause you to pass out. And so a full ketogenic diet, fully pushing someone into ketosis, could be bad. So Max Facto, that would be the first thing I would say, is be careful and do it with your healthcare team around you to support you if you're going to do it. Second, there's a number of research studies. Adolfo Ramirez Zamora at the University of Florida, for example, is doing a study on a keto type of drink to push into mild ketosis, so adding some ketosis into your current diet. And then there might be various elements of how much ketosis may be good for Parkinson. So when you say good ? I say maybe. I say don't go too hard, you might pass out. I say don't do it without your healthcare team and your family behind you, but there may be something to it. And the only way we're going to find out, Max, if there's something to it, is if we do studies with proper control groups, people that are getting active ingredients and people who are getting controls, and we can see the different types of Parkinson that may be beneficial for individual persons. So there may indeed be something to ketosis and to nutrition and the microbiome, and so that's one aspect. And so thank you for that question. I will also throw out the tips that many patients are using probiotics and other nutritional elements right now and asking us which ones to use, and we don't know the answer, but we were too dismissive, okay, as a field about dietary changes and nutrition. And now we realize that there is some gut-brain connections, okay, and there's a large grant that's funded by the Parkinson's Foundation, a large research center of excellence on the gut-brain connections in Parkinson's, to Matt Lavoie and colleagues. And we know that certain bugs, like the gastrointestinal or the GI bug in your gut named H. pylori, they will be in half of people who are tested, a third to a half, and that when present, they can affect the absorption of medications. And so we know that this is important. And we've seen some patients with absorption problems and without absorption problems saying when they take probiotics that it seems to improve. And so we have 2 nutritionists that are working with us. We don't have the answer, but we do need to begin to do the studies and see if you take a probiotic, does it help with absorption? Does it help with constipation? Does it help with the other symptoms? What are the short and long-term benefits? Could it hurt? Could it be something on the other side? So we're hearing a lot of good stories, but good stories aren't enough. Again, just like in the keto issue, we're going to need to put this to the test. Probiotics are pretty safe. You can get them over the counter. Don't overdose on them. But we do need people to be enrolling in these probiotic studies. So look at clinicaltrials.gov and check it out. It's super important. So Max Facto, I know you asked about the keto diet, but I throw that out because a lot of people are asking about H. pylori, and they're asking about whether or not they should do probiotics. H. pylori is, by the way, treatable, completely treatable, and can be eradicated. And we know the Nobel Prize was given for that. And people said, how could a bug cause a gastric ulcer? People said that, there's no possible way. Well, it turns out there was a way, and we now see that that this has emerged as something very important for clinical medicine. So this story might also affect our Parkinson patients. So Jan Nelson has joined us from Fair Oaks. I want to shout out to Jan from Fair Oaks, California. We're in the middle of the U.S. We've got Tammy Young on from Poolville, Texas. We want to hear about your tips. We want to hear about your questions. And we want to point out that that there are lots of resources on the Parkinson's Foundation website, including resources that we've just put up in the chat on expert care, experience, and dance in particular in response to Maria's question. I want to welcome here, we've got Rigoberto Pinto Cortez Jr. Welcome on for our Living with Parkinson's tips session about this new book that's come out. And Rigoberto wants to know, I got Parkinson at my something got Parkinson at 55, maybe spouse. She's now 65, been extremely hard to see her going from being able to do anything to having to help her with everything. We can't get her help because the father makes too much money, and they own a house. And do I have any advice for you? First of all, Rigoberto, let me start by saying that we hear these tragic stories from family members, from persons with Parkinson all the time. And so this idea that that your spouse or your loved one has Parkinson and they need help and they need services, and you can't get them because maybe another family member makes a little too much money, to qualify for certain types of services, but not enough money to pay for the actual services that you need. So you end up in this really disappointing, frustrating, and all in all, just not a great place to be. And so, what have we done to try to address this? Well, I don't think that we've done enough as a country, and when we talk in the Ending Parkinson's Disease book about being more charismatic, more aggressive, and the A stands for advocacy. So we prevent, advocate, care, and treat. Okay, so that's the pact, how we're going to turn things in Parkinson's disease. And we're going to need to advocate. So in HIV, they occupied the FDA building. They put a condom over Jesse Helms's house, to push the issues. And this is a huge issue. And so what we have now is not sufficient. We are directing our persons with Parkinson to our helpline, so our 1-800-4PD-INFO, so we can talk through with the nurses, is there anything we can do to help? We are using a lot of licensed clinical social workers and counseling psychologists to look for very clever ways to get around the system. We look at enrolling patients in research studies if we can, and look for local programs. Sometimes local governments, regional governments around the world have local programs that are set up to help. And so we have got to look under every rock to try to help. And then sometimes we can even get some philanthropy. And there's a lot of walks and a lot of of great events that Parkinson's Foundation and other organizations are doing all over the world. And, in the case of Parkinson's Foundation, a lot of that money stays there locally to hopefully help people in the areas that they need. And so it is just, we need to do more on that area. And so super question by Rigoberto. So thank you for sharing that. I'm sorry it's frustrating, and maybe we can help in something. So next question we have is from Everin, and Everin asks, this is Everin Torre, and Everin asks, what is the first thing that you would recommend to a Parkinson's patient who just lost her lifetime partner? So Everin, thank you for this question. This is not an easy question. And we did a nice interview with Bob Dean, who took the pictures for the Living with Parkinson's Disease book in the Voices of Parkinson's series. It's on the Ending Parkinson's Disease website, and that is recorded. And I did a nice interview with Lani Ali on this topic. It's also recorded on the Ending Parkinson's Disease webcast. And there is no right answer. But when I am myself as a physician, when I am talking to patients or talking to persons with Parkinson, talking to families and trying to work our way through these issues, I'm hoping in the best possible scenario that this is a process. And I know one of our dearest patients lost her husband recently, and we talked a lot, throughout, not only throughout his care, but also about treating her along the way and making sure that we have licensed clinical social workers and making sure that we have the services that are really needed to make sure not only decisions are happening, but you can feel confident about what's happening, how that transition is happening, keeping people comfortable, but also enjoying and celebrating the life. And so one of the first things that I recommend to people after losing a longtime care partner with Parkinson's is to celebrate. How does that sound crazy? Like, why is he saying celebrate? Well, if you read books like Tuesdays with Morrie and we start to think about the psychology and about meaning of life, and we think about what would the people want us to do? Well, I believe that every person that lives for some purpose, for some meaning, there's some substance in their life. And just because they pass on, the only promise that we get in life is death. The only true promise, right, that we can count on is that, right? And so it's part of who we are as humans on the planet. And so I try to counsel family members to think and celebrate the greatness of their life, what they brought, and remember that they will always be with us in some way. And all of the people that I've taken care of, they're all with me. They're all continuously with me. And so your partner is still with you, and try to honor them, for the things that they would want and what they would want to see you succeed and see you go on and see you find meaning and purpose in your life. And also honor yourself as a caregiver. There is no harder job. Let me say that again. There is no harder job. I'm not talking doctor, lawyer, accountant, politician. There is no harder job than being a caregiver or care partner. And so I think it's really important to realize that as soon as you lose someone, that you are in a situation where you have been caring for someone 24/7, sometimes for years, and you're going to need a break. You're going to need to make sure that you pay attention to yourself. And that's what the person that you lost would want for you, and that's what is important for you and for your family. And so those are some of the things that we talk about, and certainly our helpline, 1-800-4PD-INFO, we talk many patients through, and many persons rather, through this this scenario when it comes up, and it's super, super important. And you can hear me sometimes as a physician, talking with my colleagues, wanting to use the word patients, and I'm struggling and continuing to remember that these are persons. Okay, these aren't sterile patients, and so we need to move away from that. So, Everin, I hope that's helpful for you. So, Adam Shepard has a question. Any tips at all for helping my father sleep? He gets up almost every hour at night and then exhausted and sleeps during the day and sometimes in mid-conversation. So thank you, Adam. One of the chapters that we talk about is treatment of neuropsychiatric effects, and also we have a discussion about sleep. And so the tips that I have on sleep are many, but the first thing I will say is you can take it to the bank. If you don't get a good night's sleep, you're not going to have a good day the next day. Okay? Second, many people don't know they're not sleeping well until they get a sleep study, and so we should have a much lower threshold for examining sleep and ordering sleep studies. And it's absolutely crazy, somewhat ludicrous, that all of our Parkinson patients, or all of our persons with Parkinson, are having trouble with sleeping. Okay? And we are not addressing it. It's really super, super important that we're ordering studies, we're looking at it, and we're realizing that sometimes it's flying under the radar. One of the things and tips that you should be aware of is if you're getting tired during the day or falling asleep a lot during the day, that's called excessive daytime sleepiness, you may have a sleep problem. If you have Parkinson's, there's a good chance, maybe even a majority chance over the course of your disease, that you're going to have a sleep problem. Now, Adam, in your particular case, if you're getting up almost every hour during the night and then there is exhaustion, a lot of times there's a mistake made by practitioners, not on purpose, but we tend to give dopamine, and dopamine has a very short half-life, and as your disease progresses, as the Parkinson's progresses, the half-life, the amount of time that dopamine lasts, gets shorter and shorter. And so one simple thing is that as you're getting up to go to the bathroom, if you're not falling asleep right away, a lot of times you're having re-emergence of symptoms, and they may not be tremor. It might be tremor or stiffness or slowness. It may just be you can't fall back to sleep. You have insomnia. And redosing your regular either Cinemed or Matapar if you're in Europe, or whatever formulation of dopamine that you take, Ritari, whatever it is, redosing even several times in the middle of the night can put people back to sleep. And that's obviously the simple solution. Another solution is adding drugs like benzodiazepines, like clonazepam or Klonopin, and we try to give them a little earlier in the night, sometimes even as early as dinner, because they're very sedating and they could end up causing some sedation the next day when you wake up. And so that is a possibility, but also can contribute to falling and balance problems. And so we use as low a dosages as possible. Some people use melatonin as well, and that's obviously safe and over the counter, sometimes up to 10 milligrams and even more, I've heard in some cases, but we don't have a lot of studies on this. And so if you can't achieve satisfaction, Adam, with a few of these little tips, then get the sleep study and see a sleep specialist, and I guarantee you it will be life-changing, because once you help people to sleep, boy, it's really great. So Ian Rodriguez says good morning. So I'm assuming you're in the part of the world where it's morning. So welcome, Ian. Thanks for joining us for our tips on living with Parkinson's disease. And Ali says he has patience, but he needs a solution, the final solution. I hear you, Ali. That is true. We need to find solutions for these problems. A lot of times, though, Ali, I think of it as a process. The world's not perfect. But, one of the things that Davis Finney always says is make every day your best day. And I think that that's super important, to get up and try to know there's going to be challenges, be cognizant, know there's going to be challenges, and be ready to face them. So yes, yeah, thank you. So Kathy clarifies here, yes, not a patient, but my partner in care with me, his care partner and wife, so spouse on that one. So thank you. And again, I want to encourage not only myself, but other practitioners to quit referring as much as we can to patients into being sterile, and recognize, as Bob Dean did when he took those beautiful pictures, that it's persons, with Parkinson's. And so thank you, Kathy, for that comment. And Kaylena, I don't know if I spelled that, if I said that correctly. Kalela Lena Kabaloy says, thanks for going live. Hey, our pleasure to be here. Marlene Myers Spade wants to know on tips, are there familial tremors? I think we mean familial and essential tremor the same as Parkinson's disease. The answer to that question is no. And actually, in the first chapter of Living with Parkinson's disease, we talk about this, and those 4 words that you have Parkinson's disease, they are not a death sentence. Okay? Parkinson's is very livable, and we know, because we've surveyed patients, that a lot of times when we say you have Parkinson's disease, people think it's Alzheimer's, they think it's ALS. This is horrible. We have to do a better job, and knowing that there aren't enough neurologists, there aren't enough doctors, and in some places the number of doctors per person, like in the continent of Africa, is really low. When we're making the diagnosis, we need to help our people and their families to understand that this is not a death sentence. In fact, you can live with Parkinson's for decades and decades in many cases, depending on your subtype. So knowing what you have and what you don't have is important. So Marlene, why am I telling you this? Because your question was this familial, this inherited tremor disorder, what's called essential tremor. Is that the same as Parkinson's? No. They're 2 different disorders, and it's super important to differentiate them because they have different treatments and different disease courses. Now, essential tremor, or benign essential tremor, or some people call it familial tremor because it runs in families, in some but not all cases. This tremor can be a rest tremor like Parkinson, but most of the time it's when you're holding your hands at posture, and sometimes your legs, and when you're doing actions. And a lot of times in Parkinson's, the tremor gets better at action. And so it's a very different disorder. There are different associated features. It's so important to separate the 2. A good neurologist should be able to do this. We also give some dopamine to see how people respond to dopamine, and that's one of the tips to make sure you get that diagnosis right. That's chapter 1, and this is really important because your treatment's going to be different, and prognosis over time and how you're going to approach things is different. Now, you can get essential tremor and Parkinson's together, and occasionally these 2 are difficult to disentangle. And we can use a scan called a dopamine transporter scan. It doesn't need to be used regularly to make the diagnosis of Parkinson's. But sometimes if you're not sure, maybe there's a lot of resting tremor there, and you're having trouble seeing, the difference, and your clinicians are struggling, you can get this dopamine transporter scan. It's called a DAT scan. It doesn't tell you if you have Parkinson's, but it tells you if there's an abnormality in the dopamine system, and we don't see that abnormality in essential tremor. So, Marlene, these 2 are not the same, and so I hope that helps you sort of on your journey. But important, as we say in chapter 1, to get the diagnosis right. So Ian Rodriguez says he doesn't consider himself a patient. I'm fighting Parkinson warrior that never gives up. So a person with Parkinson and not a patient. So thank you for that comment, Ian. And as we live with Parkinson, I think we need to change that phenotype. So we have a question from Rebecca Richards. So welcome to Rebecca. Rebecca says, my father was recently diagnosed, and both he and my mom are overwhelmed. What would you recommend as the first steps to focus on? There's only so much they can process at once. How can I and my siblings best help and support? Okay, so Rebecca, I'm so glad that you asked this question. And so this is now the next step after getting the diagnosis right. You're kind of left, with what is this? What should I do next? And so it's important to talk to your neurologist and your team about what subtype of Parkinson you have. And so if you have a resting tremor, or if you have problems with walking, or problems with stiffness, sort of figure that out. I think that's an important bridge to cross early, to understand what you have and what you don't have, and make sure you don't have some of these other syndromes that look like Parkinson's but are not, and some people call those Parkinsonisms, and it can become very confusing. So I told you Robert Rose helped us to produce this book, Living with Parkinson's, and we have some call-outs and charts and ways that you can try to tell the difference. Now, you need to be sure, once you've got the diagnosis, that you're being aggressive with treatment. And so the real question that comes up in a lot of these cases is to start treatment or not, medications and rehabilitation therapies. And so we wrote an article for the Journal of the American Medical Association, JAMA, Dr. Melissa Armstrong and I, and there's a patient page on that article, so I would direct you to that was published in either February or March of 2020, and then a review article on the treatment of Parkinson's. Now, do I want you to go read the article? Not really. I'm going to tell you what you need to know. What you need to know is most experts are now recommending that exercise is a first-line therapy, that we are using physical, occupational, speech, and swallow early and sometimes right after diagnoses, that we use services like social work services right away, we get families involved, and that these can be very beneficial. Now, the issue that we talk about in Chapter 3 of the Living with Parkinson's book is, do you start therapy or not? And it's super important to realize that there's now a lot of literature about something called levodopa-phobia. This is where people are afraid of taking medications because they think it might make the disease progress more, or they're going to get more dance-like movements, more dyskinesia, or something bad's going to happen to them. The majority, if not all of the evidence now, points to the fact that this is not true, that if you take the right dose of the medicines and you're under the care of somebody that really knows how to adjust them, that it's quite safe. You're not going to receive a medal. We often say that's one of our tips for delaying therapy. And so if the Parkinson's is affecting your quality of life, add not only exercise and other therapies, but don't hesitate to be your own advocate and to go ahead and get treatments, and don't be afraid of levodopa and other treatments. Just make sure you're monitoring them for potential side effects and also making sure that you get them to the right dose. I will also say that the 1-800-Parkinson disease PD info, 1-800-PD info helpline with our nurses, we deal with a lot of these types of questions. We have a lot of tips, and we have a lot of books that are also free to download that are very patient and family friendly, that can help with some of these issues of navigating. And so I think that's super, super important. So Ankit Bhutani, Ankit, thank you for your question. Would like to know about hallucinations and Parkinson's. And Ankit has a 70-year-old father, and over the last year or so has had some difficulties and needs some support with walking. And so what about hallucinations? And so one of the really neglected areas of Parkinson treatment is the neuropsychiatric symptoms. And I just want to say that one of the tips for living with Parkinson's is to get past this idea of you can get depression and anxiety and that's it with Parkinson. Depression is the largest unmet hurdle in Parkinson disease treatment. It continues to be that way, and we talked about this when we published the Parkinson Outcome Project, or the Quality Improvement Initiative, through the Parkinson's Foundation, and there was an interview in the USA Today talking about how the idea of depression in Parkinson is an unmet hurdle. But what we realized in writing this book was that maybe something bigger, but certainly something that is huge and overlooked is demoralization, Ankit. So when we think about neuropsychiatric disorders, we got to think about demoralization, which can occur in 1 in 5 patients. And it's not just you're depressed or anxious or have hallucinations or some other neuropsychiatric manifestation. It's that you're demoralized and you need to have treatment for this, because you can have a better life, and people who are demoralized just are not going to do well with their Parkinson. And so we now know that this is super important, and we use inpatient, we use outpatient, we use therapies to address demoralization. When it comes to hallucinations, here's a few tips you can take to the bank. One is that most of the hallucination medications block dopamine. Blocking dopamine in Parkinson is a bad thing and will make symptoms worse. There are some medicines like metoclopramide or Reglan for your GI and gut issues, Phenergan and Comtan for your headaches or for nausea, that also block dopamine, and we should watch out for these and can cause neuropsychiatric manifestations and worsening of Parkinson. But when we think about hallucinations, like what Ankit is going through with his father now, we must get away from the typical dopamine blocking drugs, and we must think about ones that are not going to block dopamine and make the Parkinson worse while we make the hallucinations better. And there are 3 drugs, clozapine, quetiapine, and pimavanserin. Those are the big 3 right now. This is going to change over the next 5 years, but this is the big 3 that we think about for medications. But before we get to that point, we need to make sure there's not a urinary tract infection, there's not another infection. We've gone through the medications, sometimes simply getting rid of some of the medicines like pain medicines, like a mantidine or an MAOB inhibitor or a COMT inhibitor, and going to a simple strategy of just carbidopa, levodopa, Sinemet, or Matapar. Just one of the dopamine replacements, even without dopamine agonists, will be enough. And if we can't get the dose right once we've simplified the regimen and made sure there's not something else going on, then it's at that point we add one of the big 3, clozapine, quetiapine, and pimavanserin. Clozapine, by the way, requires blood monitoring. Pimavanserin is the new kid on the block and works as a serotonin inverse agonist, doesn't work on the dopaminergic system at all. And so thinking through a few of those things is important, and we go through that and give some nice tips in Chapter 8 about this treatment of neuropsychiatric issues. Tammy Young, thank you for your comment. Never give up. I won't give up, and I don't want you to give up. I also don't want you to get demoralized, which is super, super important. And we have a few more questions here coming in, so I'm just coming down. I want to mention that our Parkinson's Foundation staff has just posted the Hallucinations and Delusion web link here. Really just terrific website run by Kathy Whitlock and Leilani Pearl and their team. And so there is a great section you can click on here that's in the comments on hallucinations and delusions, and happy for you to check out that information. Mark Alexander, thank you for correcting me. It's not clinicaltrials.org, it's clinicaltrials.gov. It is a government site, .gov, clinicaltrials.gov. We have the link on here. Mark, awesome for you to point that out. I often say that I'm humbled every day for all the mistakes that I make, and as a physician, I know less every day and the more patients that I see. So it's very, very humbling, but it's clinicaltrials.gov, folks. And remember, you can still get a listing and have trials that are not credible. So make sure you're running those trials, asking for the consents and asking for the all of the information so that you can show it to an unbiased member of your healthcare team to make sure it's true research and not tourism. Richard Huckabee, thank you for your comment. We really appreciate you coming on, and thanks for complimenting us and our staff. I stand on the shoulders of the staff here of the Parkinson's Foundation, and then the great people at Robert Rose that helped put together such a great product of living with Parkinson's. Ian Rodriguez has a tip for everyone, and his tip is, if you're not a fighter, learn to be one. How well you live with Parkinson is up to you. I love that. So if you're not a fighter, learn to be one. How well you live with Parkinson is up to you. And for Adam, our team has pulled together the web link here for you for sleep and for Parkinson. And make sure if you try some of those strategies we talked about, both behavioral strategies and different medications. If it's not going well, have a very low threshold to get a sleep study. So another question by Kathy Jensen about tackling both supine and orthostatic hypotension with Parkinson's. Super important, Kathy. I'm so glad that you asked this. Orthostatic hypotension is when people are getting dizzy or lightheaded. That's the clinical symptom. When you stand up, you get a little lightheaded, or when you're changing position. And what happens in Parkinson is that over time there is a degeneration of the circuits that are part of, some people call it the automatic, with automatic functions, but it's really called the autonomic nervous system. And this is things like blood pressure, breathing, digestion. When you get orthostatic hypotension, your blood pressure drops and your pulse doesn't change up as it should normally change when that happens. And this is part of the process that can happen as we're seeing the Parkinson get into the autonomic or automatic nervous system. We can treat this most easily by drinking 6 to 8 glasses of water a day. Some people use abdominal binders. Some people have trouble pulling up stockings or compression hose, and so those aren't used as much because they're so hard to get on with Parkinson, but abdominal binders are quite good. And then, of course, going through the medications to make sure that none of the medications are contributing. All things that you should think about. And then we have several medicines that we talk about in the treatment section of the Living with Parkinson book. So some common ones are Mitadrin and Florinef, and these types of medicines. Another one is called Droxidopa, that's now on the market and available through specialty pharmacies. These medicines can cause what's called hypertension. So your blood pressure can get high when you lay down. This is a problem, right? So you don't want your blood pressure going skyrocket when you lie down. And so one of the things that we recommend to people, one of the simple tips to bank on, is move your bed up 30 degrees or sleep or sit in a chair that's upright. That'll stop you from going completely supine. Second is make sure that you are drinking a lot of water at the same time that you are taking each of your Parkinson pills, because about an hour after you take your Parkinson pills is the time when you'll see the greatest drop in blood pressure. So dopamine often drops in the blood pressure, and so when you're taking your blood pressure, and I had a conversation with a patient or with a person yesterday at the bedside about this, when you're taking your blood pressure, notice when you're taking it with regard to the time that you last took your dopamine, because if you take it about an hour after you take your dopamine, it may be at its lowest. If you take it when your dopamine's worn off, it may be at your highest. And so you want to, sort of figure out where you're at and not make decisions about the blood pressure that are being biased by when you're taking your medicine. So this is helpful information to bring to your healthcare team. Make sure you're sitting up, Kathy. 30 degrees can be very helpful. And in very severe cases, we work with our GI doctors. There are some other treatments that we can give to try to help this issue. We very rarely will add, for people when they lie down and get hypertension, we very rarely add medicines that are hypertension medicines, because that can also contribute to people passing out. So now we posted on the website here. We were talking earlier about nutrition. That was the lucky 7 in our new book, Living with Parkinson. And so there's a nice link here that's up. And I mentioned Wissam Deeb is the primary author on that chapter with Dr. Malati and myself. And Cheryl Ginsberg Smith says, "Wissam's my doctor!" 3 exclamation points. He's an awesome doctor. He trained at University of Florida as one of our fellows, was on faculty here, and is now at the University of Massachusetts. And so if you're looking for him, feel free to reach out. I agree with your comment, Cheryl. He is awesome. We didn't get to all of your questions, and perhaps we can talk to Kathy and Leilani and her team if you liked this Facebook Live about tips and living with Parkinson's and want to do it again. We did a series on Corona. Perhaps we can do it again, depending on the interest in the community. But at this point, I want to talk to you about who won the book. And so we've randomly selected one recipient of our of our tips webinar today about living with Parkinson's disease to receive a copy of the book. Our winner today, drum roll please. I wish we were on Carson so we could get that little drum roll. Lester Aaron. Lester Aaron, A-R-O-N. And we'll be contacting you, Lester, to make sure that we get your address offline for the book. Lester says he has Parkinson's, and his tip for everyone is to watch comedy that encourages laughter. In Lester's own words, he says, "It helps with good breathing for my lungs, smiling for my facial muscles. Laughing also makes my brain feel better, and my wife likes it too." So with that, I'm going to say a special thanks to the Parkinson's Foundation for putting this webinar on. It's been a lot of fun sharing tips with you. This is the book. It's out of the warehouse, thanks to Robert Rose and their great publishing house for helping us to make it like a cookbook for Parkinson. Not with recipes, folks, but with recipes for better living with Parkinson's disease. Thank you for reminding us about laughter today, Aaron, and thank you to all of the great questions and great families, and super sorry that we can't get to everyone within the hour, but it's a pleasure and honor, and also our helpline is open. It's 1-800-4, the number 4, PD-INFO, 1-800-4-PD-INFO, and our Parkinson.org website is open as well. And those of you interested in clinical trials, it's clinicaltrials.gov, as Mark helped me to make sure that I get that correct. And thank you to Irene Malati and Wissam Deeb for co-authoring this great book. So Irene and Wissam, you can see here, have joined me as partners in crime on this. And so the end of the hour is here, and thank you so much. It's been an honor to be with you, and I want everyone to live well with Parkinson. Thank you.